would like to welcome everybody to this first webinar, which we're co-hosting with Arcade, and it's Alda.
Yeah, hello.
Did I pronounce it correctly? So
Yeah,
Alda,
Elda.
will be introducing Arcade to us. I'll just introduce you a little bit to our project. So we have been funded by the World Health Organization as one of 4 systematic review centers in the world. So there's one center in China, one center in Lebanon, in Beirut, another center in Chile, in Santiago. Then there is us. And what the Alliance, it's the Alliance for Health Systems and Policy Research. So what the intention is that people, their feeling is that there needs to be more health systems research systematic reviews. But within that, what they also want is that these systematic reviews are very, very policy connected. So the mandate for each of our centers is that we have to connect with policymakers and establish the priorities for our research questions from policymakers. But then what happened was that when we did a survey amongst general policymakers and other researchers to ask them what they thought was the priority research questions, what came out was that lots of people were asking us questions about questions that had already been answered. So for systematic reviews, questions for which there already were systematic reviews. And that really is the origin of this webinar, in that we found this database called PDQ pretty darn quick through our colleague Simon Lewin, and had been searching it and actually found that for all of these questions that people were sending to us as priority questions, we could often find systematic reviews. Therefore, we thought it would be a good idea to introduce PDQ to our general audience. We'd hoped we would have more policymakers, but so that people can start, becoming familiar with it and becoming familiar with going directly there if they have particular research questions and particular health systems research questions. Okay, so shall I hand over to you now, Alda, and then I can introduce Gabrielle when you're done?
Yeah, of course. Yeah, thank you. So I would like to welcome everyone attending this webinar. My name is Elda Meraya, and I represent the Arcade project. So the Arcade projects use innovative educational technologies to strengthen health research across Africa and Asia. In Africa especially, Arcade builds capacity for research into health systems and services. The focus is on doctoral and postdoctoral training, institutional strengthening, and administrative research management and south-to-south network building. You can see more on our website, of course. And some practicalities regarding this webinar. Arcade project is hosting it through the GoToMeeting software. I would like to ask to keep their microphones muted during the presentation and unmute them only if you're going to talk. Also, there is a chatting area if you have any questions regarding the software, where my colleague Miroslava Procev is available. And then you can use the chatting area to write your questions related to the presentation. Last, I would like to remind you that this webinar will be recorded, so let's make sure it's of great quality for those who could not make it.
Thank you very much. It's my pleasure to introduce Gabrielle, and we thank him greatly for taking the time to introduce us to this particular website or this database. And so some of the things that I found out about Gabrielle, one is that he is very young, given all of his achievements, and that he is married and has 2 children. I'm assuming that he is married to the same person that he has 2 children from, but that isn't told. But he is a physician. He is a founder of he is a co-founder and president and CEO of Epistemomikos. And what epistemonikos means is what is worth knowing. So we think that we will definitely hear a lot about what is worth knowing from Gabriel today. And as I said, he is based in Chile. He is a member of the Cochrane Center. He's the co-director for the Southern American branch of the Ibero-American Cochrane Center. So he's very familiar with conducting reviews and overviewing. He is also an editor for the Cochrane Effective Practice and Organization of Care Group, which is where a lot of our reviews are done, a lot of health systems reviews are done. He's part of the GRADE working group as well, and GRADE is really what is looking at the grade of evidence. I won't go into all of that, but he's also, besides all of these other things, he's just also very interested in ICT projects, particularly within this area. So I hand over to you, Gabriel.
Thank you. First of all, I think it's a pleasure for me presenting you this project. This is the first official presentation of this project that has involved a lot of work, and the preparation of this webinar has been quite a lot of work too. So that has gone from your side, and I really appreciate that. I will start with a PowerPoint presentation of the PDQ evidence resource. Then we will go through some real examples, and there is time at the end for some questions and maybe some extra examples if you want to see a little bit more. So you should be seeing my screen now. Is that correct?
Yeah, we can see your screen. Yeah, we can see your screen.
Excellent. So PDQ evidence, it's this database that I'm going to present. What PDQ evidence stands for is pretty darn quick. And pretty darn quick what evidence that facilitates rapid access, or the database that facilitates rapid access to the best available evidence for decisions about health systems and population health. I think that's part is very important. Sometimes policymakers need to make decisions about clinical things. That is not comprised in this database, but it's in another database. I will explain more about that too. But evidence for decisions regarding health systems, interventions, or arrangements, and population health are here in PDQ evidence. This database is a version of epistemonikos database, which is the clinical database that is connected to PDQ evidence. And this version is for this specific area. Some words about epistemonikos. Epistemonikos is a non-for-profit organization based in Santiago, Chile. That is a picture of Santiago in a very clear day, and the red arrow is where we are located. And our mission is to bring high-quality information closer to health decision-making through the use of information technologies. And an important part is defining what we call evidence, what we're trying to bring to this database. Basically, we search for systematic reviews, but also for overviews of reviews, high-quality structured summaries, and also primary studies included in systematic reviews. And I will explain a lot more about why is this so important during the presentation. So, as you probably know, one of the main problems that we face when we're trying to make evidence-informed decisions is information overload. One example is PubMed or Medline database. That is one of the most popular databases in health. And now it comprises more than 23 million citations. So trying to find anything in, between 23 million citations is very difficult. So one of the challenges is how to separate the wheat from the chaff. And for instance, from these 23 million records in PubMed, only 0.25% are systematic reviews. So it's 1 in 400 more or less. So one challenge is to separate this importance, the important information from the rest. And basically, that's the goal of this Epistemonicus project is to aggregate all the relevant health evidence, and for PDQ evidence is the one that is relevant for health systems and population health into a single database. I will tell you some additional things about PDQ evidence. One is the search strategy. Where do we search for this evidence? PDQ evidence was developed and is maintained by systematically searching PubMed and other databases for relevant systematic reviews and overviews of reviews. Our search strategies are developed to locate this kind of information. We search in PubMed, of course, which is one of the biggest, but also in other databases. Now we have a list of almost 20 databases, and we conduct regular searches. For some databases, it's automated search, so it's almost daily, and for others, it's a monthly search, but no more than monthly. I need to say something about the systematic review and why it's so important to put systematic reviews at the center. The concept of a systematic review is a huge effort to locate everything or all the studies that answer a specific question, a specific health question in this case. And this process is very hard and usually takes 1 year of work. Especially if it's conducted with rigorous methods. And for instance, to Cochrane, this average is probably 2.5 years. So after all this process, what the reviewers find is a set of primary studies from different designs, depending on the question, that are the best evidence for this specific question. And that information, that triangle at the bottom of the figure, is not stored anywhere. It's in the full report of the review. It's in text, but it's not stored. It's not easy to access that. And what we do is to rescue that effort made by these reviewers by storing these studies in the database connected to the review that found them. So when we do that in a wide scale and in the biggest databases that have systematic reviews, we start having a lot of information of systematic reviews and their primary studies. We put all that effort into a single database that is PDQ Evidence. And one unique feature of PDQ Evidence is that it connects systematic reviews and their included studies. So we store that, and we're also able to make some inference about which studies are in similar reviews. And with that, we can navigate between primary studies and reviews and show some extra related information. I will explain another features that this database has. One is that it's multilingual. It's in Spanish, Portuguese, and French. You can access a web interface in these languages, but you can also search in all these languages, and the search works similar in these languages, similar to the English search. You can also see some documents or some abstracts that are translated into these languages. That part is just starting, but there is a network of collaborators translating titles and abstracts, and sometimes we identify some already translated reviews or records. For instance, the Cochrane database of systematic reviews is translated into Spanish for the Ibero-American Cochrane Center. There are some Cochrane reviews translated into Portuguese, and most of them are also translated in French by the French Cochrane Center. In the search result, you will also be able to apply filters to see the kind of information you are more interested in. There is one filter for the classification, for instance, systematic reviews, and it is important to say that all what is in that classification or that subset of records, has been classified or has been evaluated by at least 2 reviewers to be sure that it's correctly classified. We follow a very strict protocol similar to the protocol of a systematic review for incorporating documents into the database. There is also a filter for dates, or to see the more recent results, and I will show you more things when we see real examples. There is also an advanced search interface. This is probably not very useful for regular users, but it's what people conducting systematic searches, especially for systematic reviews, need to access, and is the typical search strategy that is used in systematic reviews, the Boolean logic search strategies. Another interesting feature is that there is a lot of gray literature or unpublished studies or unpublished information. And why is that? Our search process implies searching for published literature. We search into databases for systematic reviews and overviews. But then, as we go to the list of studies included in reviews, or the list of reviews included in overviews and policy briefs, we find things that those reviewers or those researchers identified in different sources and even unpublished sources. So we create a record for those pieces of information. So now there is a lot of information of unpublished reviews and unpublished primary studies in the field of health systems and population health. Probably there are more unpublished studies and reviews, usually reports or governmental reports or things that are not in traditional databases. And there is also another feature that we call matrix of evidence, or it's a tool that has been just released that takes advantage of this unique feature of connecting information between systematic reviews and studies. So as I said before, this makes it possible to navigate, but also allows clustering systematic reviews based on the primary studies they have in common. And this concept of systematic reviews sharing included studies is a proxy of systematic reviews answering a similar question. So PDQ evidence can make this inference and create a table that is the matrix of evidence that shows all the systematic reviews here at the left and all the primary studies that all these reviews include together. And in this case, these pink squares are the primary studies included in a specific review. For instance, this matrix of evidence is created from all the reviews that share information with this Cochrane review about mobile phone messaging reminders for attendance at healthcare appointments. And you can see that there are other reviews answering a similar question that use different primary studies. I will come back to that. But the other interesting thing is that this tool or this feature of PDQ evidence allows you to save this into your account, and you will be notified when when new evidence appears. So automatically we will send you all new reviews answering this specific question, or new primary studies that have not been identified for reviews before. I will show you some real examples after the presentation. I also want to say some words about how do we feed PDQ evidence. I think it's important to understand the amount of work that is behind this database. Basically, we combine machine technology and human collaboration. We have a very robust team of developers that have been working for 5 years in the software. The database was released 2 years ago, but there was a previous work in software development for 3 extra years. And there are more than 400 collaborators of epistemonics. Some of them are specifically devoted to have PDQ evidence complete that do this process. And how the things work. For instance, the machine or a robot goes to PubMed and conducts the searches and upload all the potentially eligible records. And then a network of collaborators evaluate each record and include systematic reviews that are real systematic reviews that fulfill some specific criteria of systematic reviews. And then another team extract the studies from the full text of the article and upload that information to the database. So basically, as you see, there are a combination of technologies, and there are many technologies to facilitate human work more than replace human work. Nowadays, the PDQ evidence has more than 30,000 records and 3,300 systematic reviews, which is one of the biggest collection of systematic reviews in this area. And before going to some real examples, I want to show you the conclusions. It's a one-stop shop for evidence. It's a multilingual database. It's user-friendly. We're very interested in making it very friendly. I will show you more about that in the real examples. It creates this relation between articles answering a similar question that is potentially one of the more useful features of the database, and allows to visualize all the evidence for a specific question. Now I will go to my web browser to show you some real examples. As I mentioned before, the database works in 4 languages. The results are quite similar. If you search in any of these languages, you will get the same results, even if the record is not translated into some of these languages. I will switch to English, which is probably the one you're more familiar with. But you can also search in all the languages of the database when you are in the English interface. You can search in English, Spanish, French, or Portuguese, or you can use a combination of words. There is an advanced search interface, but basically for most of the users, this interface that is friendly will work better. I will show you an example of the evidence that conditional cash transfers improve health, and you can you can enter very simple search strategies for cash transfer for proving health, or simply cash transfers, and you will see the result. So as you see, that you have some results. Some of them are classified as overviews. Primary studies, that is the category that we assign for all primary studies, independent of the study design. In this case, this is a particularly interesting example because this overview of reviews is in 3IE database. It's not a journal. It can be considered gray literature in some way. It's a report. And the first primary study is in the World Bank Economic Review. That's more like a journal, but it's not in PubMed, for instance. And the third one is also a report, a working paper. So most of the information in this topic is not published. So how do we have this information in PDQ evidence? Is because this primary study is included in one systematic review, and we can navigate from the studies to the reviews in a very easy way. So in this case, this primary study was included in a review that is in the Epicenter, one of the databases we search for. And based on these connections between reviews and studies, PDQ evidence is able to suggest related evidence. And if I want to see other systematic reviews, I can go through the other two systematic reviews that share studies with this one. I can also select these filters if I want to see more, and then I will see all the systematic reviews. For instance, this is the Cochrane review. And from the Cochrane review that has a broader scope, I can see 10 systematic reviews that are connected to this one. And one of the things that you will see here is all the systematic reviews that are connected to this one, and all the primary studies that are included in this review. Sometimes it may I will show you now another example that is if sending messages or mobile phone messages to patients to increase attendance, improve the rate of attendance to healthcare appointments. But now I will search in Spanish. For instance, in Spanish you say mensajes, that is messages. Mobile phone is cellular. And increase attendance is aumentar asistencia. And in this case, you will see that the database did not find any study. So you can find some extra advices to get results. One of the things that you can do is to click here, and you will go to a broader search strategy, or you can refine your search, or you can go to the clinical database if your question is not about health systems and population health. So in this case, I will just click here, and I click in the broaden search option. And in this case, you see one review that is very relevant, that is connected with some systematic reviews. However, these reviews may be related, but you can get more information if you visualize all this information in a different interface. So if you're logged in to the data, it's free to log in to create an account. You will get more features. One of those is the matrix of evidence. I will come back to English so you can see this. And I will show you the matrix of evidence. That is this diagram here of the related article, but in a different interface. I think I have it. Sorry. And you have some options, but I will go directly to the matrix of evidence. So this is all the evidence that is related to the review I was reading, this one, the one in light blue. You can select more studies in common, that is a way of approaching that the question is similar, more similar. So I will select 30%. So in that case, for instance, you will have very related similar questions, clinical or health questions, and you can see the titles of the reviews that are really similar to the one I was exploring in the first step. And then you can save that. You can save it in your account, and you can also edit this matrix of evidence. So if you think that this review is not of interest to you, you can remove it, and everything adapts to that. And if some primary study is not of your interest, you can also remove it. And at the end, you can save it, usually with a title that is the PICO question, or a question that has all the components of a well-structured question. And when it is stored in your account, you will have access to this section, My PDQ Evidence. All your saved matrices will be there. But also you will be notified when there is new evidence about this. So the software will flag when there is new evidence, and you will be able to add it to the matrix if you think it's relevant. For instance, in this case, there is a new systematic review, and this review brings some new studies. So you can studies that have not been identified by previous reviews, and you can decide if you will add or not these studies to your matrix of evidence. So in some ways, a very good approach to keeping the body of evidence for a specific question update. I will come back to the results of all the related reviews. It is important to say that you can easily navigate from the reviews here, all the related reviews, to the cash transfers review that we were reviewing, and you have the abstract here, or you can switch to see the primary studies included in one review. In this case, it's taking a while, and I don't know why it's here. So this is the list of primary studies included in each review. So it's very easy to navigate between reviews and studies in the different interfaces. There is more about PDQ evidence in this section, about PDQ evidence. It explains more about how the database is built, the search strategies, the database we search for. There is my PDQ evidence section where you can save some favorite documents, some searches, and some and your matrices. If you are using Epistemonicos, the clinical database, that also will be saved here. So that's why I have some clinical questions here. That is something that is interesting because usually policymakers need to make decisions about clinical interventions too. The project is still in progress. We are developing new features, and we are in a very interesting moment. We are releasing this matrix of evidence, and we are starting to increase the number of sources we are searching, and we are developing more features to increase or improve the search interface, or to make easier to find the more relevant evidence for a specific question. So that's what I wanted to show you, and now we have time for questions or to see more examples.
Yeah.
Yeah. I'm not here. Are you there?
Hi. The presentation was very clear, and it's an amazing tool that I've not seen before. And you showed us abstracts. Is there a way to link to the full review, if it's available, to get the full review rather than just the abstract?
Mm-hmm. Yeah, absolutely. All the records have a link to the full review, the publisher site, or the record in PubMed, or in this case, for instance, the full review is here in PubMed Central, and it's free. It's open access, and in some cases there are some paywalls that the journals apply, but we're trying to facilitate the access to the full report, or the free version of that, when it is available. For instance, the Cochrane database of systematic reviews is here, and if you have access to the full report, that will open in the publisher side.
Yeah, yeah. And then a second question, you do health systems and population health. Are the reviews only around interventions? Do you include systematic reviews of epidemiology? So, for example, the impact of a particular risk factor on a health outcome?
Yeah, that's a very good question. I think it's important to clarify that we should search not only for interventions. Basically, the definition of what we call health systems and population health is in the About PDQ Evidence section, but it's these 4 areas of arrangements for health systems, and also public health. but you will find more information about questions that are not related to the intervention or the effect of intervention, but that's basically because the number of systematic reviews are bigger in intervention reviews. So basically, we don't put a filter for the type of question. We incorporate any kind of systematic review, but basically the difference that we will have is the number of intervention reviews, basically because the literature is more prominent in intervention reviews. But we are seeing more qualitative studies and reviews of qualitative studies, reviews assessing barriers and facilitators, systematic reviews addressing prevalence or magnitude of effects or magnitude of a problem. So I think that it's changing very, very fast.
Okay. You're getting a thumbs up on this side, Gabriel. I don't know if there are more questions coming through on the chat, but I have two questions. The one is, what did you mean when you said earlier about real systematic reviews? So what would not be included? And the other question is, if I had a particular question, I mean, because your system is very sophisticated now, I'm sitting and I have a question and I don't know how to find a review. I've looked at Cochrane, I've looked at PubMed, I'm still not finding anything. Can people write to you and ask you to help them establish if there is a review or not?
Yeah, regarding the first question is we use some, yeah, probably real systematic review was not the correct term. We have some criteria to say that a review is systematic, and basically are summarized here. We took the criteria that their database developed, that are there. It's a set of criteria about that it's quite sensitive. So most reviews fulfill this criteria. More reviews that call themselves systematic reviews. So I think it's not an important problem. So most reviews that you would consider systematic reviews will fulfill this criteria, except very bad reviews or very low quality reviews. But we don't have a very strict. We don't separate good reviews from bad reviews. It's just a definition of systematic, the minimum standards to being called a systematic review. And regarding the second question, I think it's not something that we provide as a service in the database. That especially at this stage, we're very interested in that kind of interaction to know what did you find and what you were not able to find. And I will be happy to help if you write an email to me. You can also, there is also an email to contact the database that is now managed for someone in the Center for Knowledge, Health System Knowledge in Norway. I don't remember the English. It's the Kunnskapssenteret in Oslo, where the EPOC satellite of Norwegian satellite of EPOC, the Effective Practice and Organization of Care group of Cochrane, is located, and you can also contact through that email. But if you send me an email, a personal email, I will be happy to answer that kind of questions too.
Okay. Shall I open it up to other people who, because we have several people, Debbie, Jackson, and Darshini's here. people we haven't met before, Linda and Lovemore, Russia from Lebanon, some of the people we don't know. HST is here. Welcome, HST. Nazia is here. Was here. So if anybody has any questions, I think you, Alda, I think they have to unmute in order to ask a question. Is that right?
Yeah, they can unmute their microphones and they can ask any questions.
Okay. Because there only seems to have been one question about the attendees list above.
That was a small, let's say, mistake I did about that. It's not actually list there, but I would like the people to have their real names so that we can have a better interaction.
Okay.
How does this gray literature work? How does it pull that in, and how does this sources gray literature?
Did you hear that, Gabrielle? So, Gabrielle, no. Can you hear me? Okay. So the question,
yes, I can hear you, but I didn't hear the question.
Yeah. So the person is also here in Cape Town. It's Victoria, and she's asking how your grey literature works. How do you source it?
Can you repeat? Sorry, I didn't find I didn't hear the last.
The grey literature, because you said that some of, like the one with the WHO, or not, sorry, with the World Bank. So what Victoria is asking is, how do you source that material?
Yeah, that's a very good question. Yeah, as we search for reviews, systematic reviews, and then we go to the primary studies that the reviewers found. Usually, grey literature and reports are part of that set of primary studies. In the case of systematic reviews, they found primary studies that are not published or are grey literature. So then we go through different methods to the original source, and we create a record for that that document or that primary study. So basically, what we have different, it's traditional bibliographic methods to create records, and we enter that into the database. So we can enter all kind of information that the reviewers found, independent of if it's published or not.
Okay. Thanks, Gabrielle. Debbie Jackson has got 2 questions. So Debbie, if you want to unmute, and then you can I don't know, do we need to unmute Debbie?
Oh, got it. Okay, hi, this is Deborah. The first question I was wondering about is the one is a quick one. The primary studies and/or the systematic reviews. Can we get the full document PDF, or you just provide the list and then we have to go and get it from other sources?
Yeah, it's an interesting issue because now there is a big debate in the world about access to full reports or full text of articles. There is an open access movement that is growing very fast, but there are still many journals that don't allow free access or open access to their articles. So it's not possible for us or any other database to provide access to all the full text reports. So what we try to do is to facilitate the access to any free source that we can find. One of the more popular ones, one is let me show you the cache transfer again. Is Google. Google is able to lead you to a free full text report in different places. So, for instance, if you have a link, a direct link to all the documents in Google Scholar for some articles. And Google Scholar will lead you to the full text report. As they index everything in the world, they can give you access to some things that probably the journal has not even considered, like this one. I don't know if it's going to work, but in this case, this is a full text report. No, this one is not working, but this one is a PDF that is in some place.
Mm-hmm.
And instead of entering this information into PDQ evidence, we provide access to the full text report whenever it is available. We have a protected area with many full text reports that are used for some researches, and there we have PDFs. But basically, the reason why we don't provide access or give free access to the PDFs is that this copyright and this problem with the journals. It's not a technical issue. Probably we have most of them, but we cannot give access in that sense.
Okay, my second question was, and I know you kind of spoke about this, so I was trying to understand, as in this database, how you define things. I know there's a little list of things for that's health systems. Do you look for those keywords, or it has to say delivery or something like that? I mean, I think it listed 4 things that you look for, but I was wondering how you actually figure out that it includes those things just from titles.
Yeah, that's a very, very interesting question, because indeed the idea of creating PDQ evidence was a response to that problem. Nowadays there are no hedges or filters to identify this area with reasonable accuracy. So what we do is to screen all the systematic reviews, because we have this other project that is Epistemonicos. So all the systematic reviews are screened by someone, by a team of researchers, and they decide if it fulfills the criteria for health systems. It's a manual process, and it's made in duplicate. So we're pretty sure that the documents that are in PDQ evidence are correctly classified.
Okay, great, thank you. Back.
You're welcome.
Hi, and a question from Ari?
That's for me, Karen. Thank you.
Thanks, Deborah.
Gabriel, you said you do translations, but you don't do back translations to English.
Do you mean articles that are not in English, if we translate it to English?
Yeah.
Yeah. There are not many articles, but when we find one of those, we back translate it to English, and in that case we try to do that very quickly, because the English interface is it's the one that I have shown. The non-English interface mix articles in different languages. So the users of the non-English interface quickly realize that there are a combination of documents. But in the English interface, the user expect to see everything in English. So we quickly back translate to English when we find something that is not in English. But I think as PDQ evidence is a database of abstracts, it's not all the full text that is being shown. It's very rare to have a document that doesn't have an English abstract, but there are some.
Thanks, Ari. Are there any more questions from our colleagues around the world? I think you just need to type in a little box you'll see on your screen on the right-hand side, as Debbie did, so that we know that you have a question, and then Alda will unmute you. Nothing more? Any more from you as a policymaker? Okay. So I think those are all the questions. I don't hear anybody or see anybody putting up their hand. So if we can firstly just thank Alda and Arcade for providing us with the software, and to Sala as well, who hasn't joined us, for very kindly allowing us to use your platform or your software or your system. I don't know what IT correct words are, but the thing.
Thank you. Thank you. Our pleasure. Thank you. It was our pleasure.
And for managing it. To Gabrielle for making the time. Thank you very much for doing so. To the people in South Africa in our time zone, thank you very much, because it is late on a Friday afternoon, so thank you very much for making the time. And from our side, particularly to Debbie Bradshaw, who has hosted us in Cape Town. So we don't have our webcam, but we have had quite a full room of people down here. And of course, to all of our participants who have come, we hope that you have found this useful, and we most certainly look forward to interacting with you, to hearing from you. If you want to know more either about us or about Arcade or about Gabrielle's work, please do email Ari, who you emailed, in order to become a participant, and he will give you the links to all of the work. So, okay, so Deborah's asking, will we send a link when we post the webinar so we can share? Absolutely. I think that's a very good idea. So when we do the webinar, we'll tell you, then we'll give you a link for our work for Arcade and for Gabrielle. I think.
If Gabrielle, will you make your PowerPoint separate available, please?
Yes.
Thank you.
Okay. Any further questions? No? Okay, then have a good Friday to Deborah and Gabrielle in the North and South America, and to everybody else in our time zone, have a good weekend.